Welcome back to the Deep Dive. Today we are taking a stack of source material and diving deep into a topic that, well, it touches almost everyone at some point. Dry skin. Technically, it's known as xerosis, but if you've ever dealt with that uncomfortable tightness or the flaking or that persistent, distracting itch, this deep dive is definitely for you.
It really is. And it's so easy to just dismiss dry skin as a temporary, cosmetic issue.
Right, just put some lotion on it.
Exactly. But our sources show that when it's left unmanaged, it's not just about flakiness. It actually compromises your skin's fundamental protection system.
So it's a bigger deal than it seems.
A much bigger deal. That can lead to chronic discomfort, redness, and in really severe cases, painful cracking or fissures that are susceptible to infection.
Wow.
So our mission today is to cut through all the confusion, understand the root causes, and equip you with actionable knowledge to manage your skin barrier effectively.
And we had a fantastic set of articles to work from. They outlined everything from genetics and environmental factors to, well, the real science of barrier repair, chronic conditions, and some highly practical strategies.
Yeah, for both home treatment and professional intervention.
It's a gold mine of genuine insight. Okay, so let's unpack the #1 source of confusion in, I think, all of skincare marketing.
I know exactly where you're going with this.
Dry skin versus dehydrated skin. These terms are used interchangeably all the time, but our sources make it abundantly clear they are two very distinct conditions.
And they require completely different approaches.
This feels like the big aha moment of the entire deep dive, honestly.
It really is the essential starting point. The difference comes down to what your skin is missing.
Okay.
So dry skin is characterized by a fundamental lack of natural oils or lipids. Think of it as a skin type.
A type, not a temporary state.
Exactly. It's often chronic, it's influenced by your genetics, and sadly by aging, because as we get older, our skin just naturally produces fewer of those oils.
So if you have true dry skin, what does it look like?
You'll see rough, flaky, or scaly patches, and you're probably more prone to conditions like eczema because that protective barrier is just inherently weaker.
So dry skin relates to oil production. It's missing fat.
Precisely. Now, dehydrated skin, that's characterized by a lack of water. This is a skin condition, and it's temporary.
Ah, so anyone can get it.
Anyone. Crucially, it can affect any skin type, even someone with naturally oily skin. It's caused by external factors like weather, stripping products, or, not drinking enough water.
And how does that feel differently?
It feels tight, it looks dull, and if you gently pinch the surface, it shows these fine, almost tissue paper-like lines. That's dehydration.
That distinction is phenomenal. So what's the biggest mistake people make when they don't know the difference?
They waste a lot of money. If your skin is dry lacking oil, buying a hyaluronic acid serum, which just pulls in water, won't solve the problem.
Why not?
Because you don't have the oil to lock that water in. You need a thick cream to seal the deal. But if you're dehydrated lacking water, you do want those serums first, but maybe with a lighter cream.
Okay, that makes so much sense. Let's move on to the physical signs. We all know what mild flakiness looks like, but how do we identify if we're moving past that into something more concerning?
Well, we need to look closely at the texture and appearance. Mild dry skin is just a little rough to the touch.
Right.
But as it progresses, you start seeing visible flaking or peeling, often on areas like the shins, arms, and face.
I've seen that ashy look some people get.
Exactly. If you have a deeper complexion, dryness often makes the skin look ashy or dull, which signals a significant breakdown in the outermost layers.
And what about how it feels?
It's that persistent itching, redness, and a real tightness, especially if it happens like within minutes of stepping out of the shower.
I think most of us just assume it's cosmetic, but you mentioned infections earlier. How quickly can that compromised barrier become a real medical risk?
Surprisingly quickly. If the dryness is left unaddressed, the skin barrier, well, it just fails. It loses its elasticity and develops small cracks or even painful deep cuts we call fissures.
And those are basically open wounds.
They are. They make you really vulnerable to bacterial infections. And on top of that, chronic dryness is the perfect breeding ground for eczema flare-ups.
And what if the itching is so bad that you're just scratching constantly?
That leads to a condition called lichenification. The sources describe this as purely mechanical damage. Because the skin is constantly being traumatized by scratching, it thickens. It becomes leathery, tougher, and darker.
Wow. A visible long-term consequence.
A very visible one. And the sources also list several chronic conditions where dry skin is a major factor.
More systemic things, right?
Yeah.
Not just your environment.
Yes. Dryness can worsen conditions like psoriasis, making the plaques thicker, And then there are genetic conditions like ichthyosis, which results in severe fish scale-like skin appearance.
So that brings us to when to see a professional. If I'm using a good moisturizer, I've got the humidifier going, but I'm still struggling, when do I give up?
You should consult a dermatologist if the dryness is just not getting better, or if it's accompanied by intense itching that interferes with your sleep.
Or if it's bleeding.
Absolutely. If there's bleeding or you notice any sudden severe changes, the diagnosis involves a deep dive into your patient history, your routine, your environment, your family history.
And you mentioned they look beyond just the skin. The sources said blood tests might be involved.
Correct. Your skin often acts as a visible indicator of what's happening internally. Persistent, severe dry skin that doesn't respond to standard treatment can be a sign of things like hypothyroidism.
A sluggish thyroid.
Right. It affects your metabolic rate, your cell turnover, or even diabetes, where high glucose levels impact hydration. You have to rule out those systemic drivers.
So we've covered symptoms and that key oil versus water distinction. Now let's drill down into the causes. What are the specific daily triggers we should all be aware of?
We can break them into environmental culprits and the internal or habitual ones.
Okay.
On the environmental side, everyone knows cold weather and low humidity are enemies, but the sources really stress two factors we control: indoor heating, which just sucks moisture out of the air, and harsh winds.
And I think the biggest habitual culprit for most people is probably water itself, right? Specifically hot water.
Oh, absolutely. That is perhaps the single worst thing you can do to dry skin.
What's happening chemically there?
Hot water doesn't just feel good. It actively emulsifies and strips away your natural sebum and the lipid layer. It essentially acts like a detergent, dissolving your protective barrier.
So a long hot shower is basically an attack on your skin.
It is, which is why the sources strongly recommend limiting showers to short, lukewarm baths, ideally no more than, say, 5 to 10 minutes.
That's a tough habit to break.
Yeah.
What else in our daily routine is eroding our defenses?
Your product choices. Using harsh soaps, cleansers with a high pH, or over-exfoliating. All of that strips away necessary oils. And internally, we talked about aging and general dehydration, but we have to talk about nutrition.
Right.
Poor nutrition, specifically lacking things like omega-3 fatty acids, vitamins A and D, these are the literal building blocks for healthy cell membranes. Without them, the barrier is weak.
And what about medications? Which common pills might be contributing to this?
Certain medications are known for it. Diuretics for high blood pressure increase water loss. Antihistamines for allergies can reduce oil production.
And some acne treatments, I'd imagine.
Definitely. Especially systemic retinoids. They're specifically designed to reduce sebum, which leads to significant dryness all over.
It really is a complex puzzle. You have to watch your climate, your diet, your medicine cabinet all at once. Okay, so let's shift focus. What are the easiest wins? What can we do immediately?
The biggest win, the golden rule, is to moisturize immediately after bathing.
While the skin is still damp.
Yes, while it's still damp, that moisture on the surface needs to be trapped. If you wait even 5 minutes, it's already evaporating.
What else?
Environmental control. Use a humidifier, especially while you're sleeping. And protect your skin from harsh weather with scarves, gloves, and of course, a good broad-spectrum sunscreen.
Let's talk diet. The sources list several things to avoid. We often focus on topicals, but what we eat and drink clearly matters. So caffeine and alcohol, how bad are they really?
We're generally talking about heavy consumption, but the mechanism is what's key. Both are diuretics. They promote fluid loss, which leads to systemic dehydration that shows up first in the skin.
So my 1 cup of coffee is okay, as long as I'm also drinking water.
A moderate, well-watered caffeine habit is fine, but relying on coffee all day instead of water, you're going to see that on your face.
And what about salty foods and sugary foods?
Limiting salty foods helps prevent cellular dehydration because salt draws water out of your cells. And the connection to sugar is all about inflammation. High sugar intake causes inflammatory responses that impact your collagen and reduce the skin's ability to hold on to moisture. The takeaway is holistic. Drink water, and reduce the things that fight water retention.
Okay, now for the products. When we're standing in that skincare aisle, completely overwhelmed, what ingredients should we be hunting for?
You need a dynamic duo. First, you need a humectant. These are what pull water into the skin.
Okay, things like
hyaluronic acid, glycerin, even natural honey. But second, you need an emollient or a barrier repair agent. These are the seals. They fill the cracks and create a protective film to stop that water from just evaporating away.
So the humectant brings the water and the emollient locks it down. What are the best sealing ingredients to look for?
Look for rich, thick oils and butters. Shea butter, coconut oil, jojoba oil, avocado oil. Also, specific barrier support ingredients like colloidal oatmeal extract and aloe vera. These are what physically mend the barrier.
So if we were to build the perfect, high-impact 7-step routine for barrier repair, what would that look like?
It starts gentle. A non-foaming hydrating cleanser. Then a hydrating toner. No harsh alcohol. Third, a serum, ideally with a humectant like hyaluronic acid, on a still damp face.
That's the key part, right? Damp face.
The most important part of that step. Fourth, your rich emollient cream. Be generous. This is the critical sealing step. Fifth, daily SPF 30 plus, non-negotiable.
And for extra credit.
For extra care, an overnight mask for intense hydration. And of course, run that humidifier at night.
I'm glad the sources included makeup tips. It's such a common frustration that foundation can look patchy or cling to dry areas.
It totally defeats the purpose if it just highlights the problem. Yeah. The core directive here is avoid powder whenever you can.
Okay.
Use a hydrating primer, choose a moisturizing liquid or cream foundation, and apply it with a damp sponge to press it in without dragging.
What about blush and bronzer?
Go for cream-based products there, too. And if you have to set anything, use a hydrating setting spray, not a matte powder. And don't forget to prep your lips with a good balm.
Let's revisit some of those natural home remedies. What did the sources identify as actually effective?
They listed several that really align with modern science. Applying pure coconut oil or shea butter right after a shower is an excellent, inexpensive moisturizer. A simple honey mask leverages its natural humectant properties.
And for irritation?
For irritation and itching, a colloidal oatmeal bath soak is scientifically proven to soothe. The sources also mention things like an avocado mask mixed with olive oil for their richness in essential fatty acids.
And just to circle back to those severe cases, when the home routine isn't enough, what are the serious treatments a dermatologist can offer?
When it progresses to a chronic state like eczema, you need prescription strength. They might prescribe moisturizers with high concentrations of ceramides or urea to really rebuild the barrier.
What about for the inflammation itself?
For active inflammation and itching, they'll use short courses of topical steroids. And for very complex chronic conditions like stubborn psoriasis, professional light therapy phototherapy can be used, sometimes with oral medications.
That covers the full spectrum then. From understanding the lack of oil versus water to the triggers to a clear action plan.
The central idea is consistency and context. Know if you need oil or water, and protect your skin barrier from enemies like hot water and dry air. But I think the most powerful takeaway from all of this remains that systemic connection we touched on.
Right. We learned that a clinician's job isn't done once they've just diagnosed cirrhosis. They have to rule out other conditions.
Exactly. So if you, the listener, have been absolutely diligent, you bought the rich moisturizers, you're running the humidifier, you've cut back on caffeine and hot showers, yet you still struggle with persistent, severe, unresponsive dryness.
Then what?
Then you have to ask, what deeper systemic internal issue might you need to explore with a healthcare professional?
Because sometimes the symptom on your skin is just the body relaying a message that something bigger is going on underneath the surface.
Yeah.
That is a question worth truly mulling over.
Thank you for joining us on this deep dive into decoding dry skin. We hope you feel thoroughly informed and ready to start protecting that skin barrier immediately.